One of the things that drew me to critical care was the ability to support patients and not just patients, but families in the midst of a severe healthcare crisis. We have a whole team of people looking after a patient, and unless that team is cohesive, then we can't deliver the best care.
I love taking care of people. It's been my passion. I've been doing it for years.
What brought me to North York General Hospital is my daughter, Lisa. She was a patient here numerous times. When she was 12 years old, she was diagnosed with Crohn's disease. Over the years, as she grew and she developed, nursing became her passion. She really saw that nurses were really important in her well-being, and they listened to her. Lisa did miss a lot of school. It was actually from a hospital bed that she applied to nursing school.
So in the ICU, all the patients who are critically ill will have a respiratory therapist following their care. We intubate the patient, we put in a breathing tube for them, we attach them to life support, we resuscitate newborn babies. So as an educator, any new staff that comes into the hospital, I would be educating them on how to use oxygen therapy, if the patient's ventilators start alarming, how to deal with patients that are in respiratory distress.
I think part of ICU is unpredictable, meaning that some days are quiet, patients who have been admitted stay stable. I think one of the challenges of ICU is that things can happen at any moment.
She became a nurse and was a nurse for several years. Unfortunately, over all those years, her health diminished.
She was young, one of the younger patients that we get in the ICU. Her mom would come in daily when she was unconscious and she was no longer able to communicate.
She obviously couldn't speak for herself, and I was her voice.
Just having her there make our day a little bit easier, to knowing that she's at the bedside and supporting us.
I think families play a particularly important role in the ICU because patients, when they're critically ill, can often not speak for themselves.
At North York General Hospital, we implement what is called a patient-family-centered care. They know the patient best.
Anything that we do is a collaboration between all team members.
Team members here know their role. We trust each other. We have complementary skill sets.
Working here at North York General Hospital is like a family affair. We get together, we talk about the good, we talk about the bad, we talk about how we can improve. It's a judgment-free zone. You can say what you feel.
I've been to many hospitals, and I can honestly say that the care that she had here was just the best. To carry on the memory of my daughter, it's really important that I share. I went through some of the darkest moments of my life here, but also the humanity and the kindness of the staff have stayed with me, and it's important for me to continue to support them.
North York General ICU is a great place to start your nursing career. You get the good foundation of what it takes to be a really good, excellent nurse.
We want people to come here who love working in teams, who are committed to excellence, who are always open to learning.
Initially, it might be very difficult. There's a lot of challenges when it comes to dealing with very sick patients.
But of course, there also is the good side where we see patients improving and where we're taking patients off life support safely, where we're transferring them to the ward.
If you stick it out, learn from the seniors, you will be able to take care of that patient one day, and you'll be very proud of yourself for providing that care to someone who needs it.
This is me getting passionate now, I'm sorry. You're a part of the team that helped them get over whatever was, whatever the sickness was at the time. I love that. That's the best feeling ever.